Hi, Dr. Claire. Thank you so much for coming to Baylor Scott and White today to help me take over a patient as I go on vacation. A little bit about her. Her name is Isabella Jones. She's 21. She was born on November 17th, 1997. She's allergic to shellfish, cephalosporins, and latex, so it's really important that you use the latex-free gloves, as well as if she gets any infections that you steer clear of cephalosporins. She came in on the 13th complaining with angina, fatigue, shortness of breath, edema, and heartburn. So she had pain in her chest, swelling in her legs and her feet, which is pretty common and signs of heart attack. Her blood pressure was 164/110. Her pulse and her heart rate was 120. Her temperature was pretty normal, 99.7. She's 5'11" and 240 pounds. There was normal airflow to her lungs, no signs of pain or injury in her abdominal cavity. Her muscles were tender, but the reflexes were still good, and she's, like I said, had signs of edema. The exams I ordered was an echocardiogram, electrocardiogram, and blood tests to weigh out any high cholesterol, high blood pressure levels, see if that would have been a root cause, as well as to see if there was any plaque buildup in her heart, see if her heart was pumping correctly, making sure the good amount of blood was being flowed back and forth. We found that she does have high blood pressure and plaque buildup in the heart, and she also has a history of smoking for about 7 years now. Preoperative diagnosis, we came up with 3: atherosclerosis, cardiac ischemia, and a possible myocardial infarction. So we decided to do an atherectomy to remove the plaque from the arteries and place in a stent. So during this procedure, you will sedate her intravenously and give her general anesthesia, then transmit her to an OR, typical standard. Then you'll place a catheter with a sharp blade into her pericardial cavity to reach narrowing in the arteries, and then you will remove the plaque. After that, you're going to go in and place a stent. So our final diagnosis was cardiac ischemia and atherosclerosis. We weighed out the myocardial infarction, which is good for her. She's too young to have a heart attack, so we told her to worry less, as well as we're going to start her on some lisinopril and hydrochlorothiazide, get her some diuretics to help with the excessive fluids in her legs, as well as to help with the high blood pressure. We also need to talk to her about lifestyle changes, make sure she's cutting back on smoking, as well as starting her on Chantix to help her wean off of smoking. And we need to schedule follow-up for next week to make sure her stitches are healing properly and that the stent has not moved and that all the plaque was removed. So thank you so much again for coming to help me with this. I really appreciate it. You have a good day.